Hi, my name is Gaston. For my final project, I decided to discuss prostatitis. The reason I chose this specific diagnosis was a couple weeks ago. I was circulating a case in the operating room where I work as a nurse and came across an individual who was suffering from this specific diagnosis. He had several procedures performed before, biopsies to rule out cancer, cystoscopes, cultures performed. They couldn't determine the reason why he was suffering from it. So the only other option left was to have his prostate removed. Um, this option was provided by the surgeon or urologist, and during the case, he ran into complications that we weren't expecting. This led me to come home, go ahead and do further research, and focus on what prostatitis is, some of the effects it has on the individual, and how it leads to this specific diagnosis. So we'll discuss this in further detail. Prostatitis, it's a variety of inflammatory disorders of the prostate gland. It can either occur spontaneously through catheterization, so someone has a urinary catheter put in, or a in and out catheter just to drain the bladder quickly, so that way the catheter doesn't stay continuously. It's just put in, drain the bladder, and remove it. But somehow a pathogen may work its way into the urinary tract system that spreads to the prostate gland and causes inflammation. Or it can occur through instrumentation. So someone's having a procedure performed like a cystoscope, and although sterile technique is abided by, although it's not a sterile procedure, these pathogens will work their way up and cause inflammation of the urinary tract system and somehow spread their way to the prostate gland. There's also secondary results, which are related to defects in the male genital urinary system. Can be congenital defects or issues with the anatomy, and because of that you have issues with reflux or not being able to fully empty out the complete urinary tract system, which work its way back up to the prostate gland. Prostatitis can be divided into 4 classifications. You have 4 categories of it. You have acute, which we already discussed, can be treated with antibiotics, usually the result or likely result of either spontaneous, even though not common in men, they develop urinary tract infections, or could be the result of a catheterization or instrumentation being inserted through the urethral opening. And then you have chronic bacterial. As I said, these infections are not common in men, so someone who is continuously developing infections or infections that result in prostatitis has an underlying issue that needs to be identified and treated. Then you have chronic prostatitis, pelvic pain. There's research on it, but it's still not fully understood. And there's asymptomatic inflammatory. These individuals have signs, but then they have no symptoms. So you see the objective portion of it, and they present usually identified on a diagnostic exam or a physical exam, but they're reporting no symptoms. The etiology of prostatitis, again, is acute, may be caused by ascending infection through the urethra by a variety of pathogens. It's usually gram-negative, or it could be through reflux in urine. So imagine gastric reflux, when that valve does not work the way it's supposed to, and stomach acid works its way back up into the esophagus and causes that burning. It's the same thing for, the prostate reflux, where the urine is supposed to drain out of the bladder. People are supposed to empty their bladder, but somehow ducts are not working the way it's supposed to. So a little bit comes back in reverse and sits there. And it's a culture, a medium to allow pathogens to develop and cause an infection, which then spread and cause inflammation of the prostate. Then you have chronic. This is primarily due, as I said, an issue with the anatomy. Usually has to do with Voiding dysfunction, but may also be applicable to pathogens like E. coli or someone who has HIV. You have fungal issues or inflammatory conditions like sarcoidosis. And then there's chronic pelvic pain syndrome. It's poorly understood, but usually a neurologic disorder that someone has. Could be pelvic floor injury, so someone suffers a motor vehicle accident or motorcycle accident and has injury to the pelvic floor. They're not able to fully empty their bladder, and because of that, it leads to the chronic pelvic pain syndrome. Perfect example of that is someone who's a quadriplegic. They're never going to fully regain that development of the pelvic floor, and because of that, they may result in prostatitis because of the issues that affect the genital urinary system. These individuals also have obstruction in their ejaculatory ducts, and also complain of pain. And then there's asymptomatic. These usually come up in, routine physical exams. These people have signs, but then they report no symptoms. It's not fully understood, but it occurs. The syndromes that prostatitis applies to, you have acute and you have chronic. Again, those both are often a subtype of a urinary tract infection, and most commonly occurs because of E. coli. They can either be gram-positive, gram-negative, but anaerobic is not common. Then you have the chronic ones. Again, as I said, it's subtle, it's difficult to treat. It begins to, subtly work its way up or just sneak up on the person. But these individuals, they begin to feel it. They can determine when it's going to happen. They have, increased urinary frequency. They're going to the bathroom frequently. They have low back pain or dysuria. The chronic pelvic pain individuals, though, these men, as I said, it's difficult to determine the cause, but they do have a, group of signs and symptoms that are easily, grouped together and can be identified. You have, painful ejaculation, you have lower back pain, they have decreased libido, and they may have had an encounter with someone who had chlamydia in the past, even though they developed an infection, and they didn't, develop it at first, but then chlamydia is one of the most common STIs that, although can be positive, comes up and can be confirmed without any signs and symptoms. Then there's non-inflammatory prostatitis. There's no signs and symptoms of infection or disorders, but these men, have obstructions, congenital defects, anatomical defects of the muscles or anything within the urinary tract and the pelvic floor. Asymptomatic, again, just comes up on the diagnostic studies or physical exams or drawn through labs, urinalysis, so forth. The clinical manifestation, again, one level may be asymptomatic with prostatitis with signs and symptoms. All the others will report. Again, there's only one that's asymptomatic. All the others will report either pelvic pain, pain during urination, groin pain, lower back pain, either difficulty urinating, have positive diagnostic studies like, urinalysis showing either leukocytes or some type of pathogen that's in the urine. And then some may even have discharge from the urethral opening. The diagnostic studies used to identify prostatitis can either be a digital rectal exam, so the provider will have to, take a gloved hand, take your digits, and enter it through the anal opening to determine if the prostate gland is inflamed. You can also measure the size of the prostate gland. Although everyone's anatomy is different, you can use the ultrasound to measure and determine whether the prostate is showing any sign of inflammation. You can also use blood tests, sending the correct tubes to determine whether prostate antigen levels are out of range. And then you can have urinalysis to determine urine cultures, specific gravity, urinalysis to determine if there are any pathogens in the urine that aren't supposed to be there. Some of the differential diagnoses or issues that can result from prostatitis can lead to benign prostatic hyperplasia, also known as BPH. You can develop kidney stones or urinary tract stones that can form anywhere in the urinary tract system and must be removed, or either stents are placed to go ahead and allow them to pass out through the complete system. Acute cystitis, so this leads to infection of the whole bladder lining. You have prostatic abscesses, so abscesses can form around the prostate. And then you have other foreign bodies that can develop in the urinary system. And the complications that occur is that the spread, if the infection does occur and is not untreated, will spread to the blood, which results in sepsis. You also have inflammation. The testicles lie very close to the genitourinary system, which are part of the reproductive system, but it results in epididymitis, which also must be treated. And then you have pelvic floor pain, which is a chronic issue if not treated, and also leads to pain with ejaculation and can also lead to sterility for the male patient. This is a reference I use. Our text for our course here, prostatitis, elaborated and summed all up for you. And this is my final presentation.